Good morning, everyone. My name is Sang, and this is my biochem protein presentation. My protein of choice is called troponin. In this presentation, we'll talk about the background of troponin, and we'll talk about always the derivation of the troponin, all different type of troponin, and what does it do as a protein in the human body. We also talk about the implication of troponin. We will talk about how troponin is used in practical application in hospital and especially in emergency care healthcare providers settings. We're also going to talk about the drawbacks of troponin, the goods and the bads of this protein and its use in critical settings. Let's start off with America. America, we know, was renownedly famous for its diet. Its diets consist of an extravagance of salt, oil, and sugar. Now, because of this had led to the different type of development in cardiovascular diseases, among other chronic diseases such as diabetes, hypertension, and hyperlipidemia. As the result of this, there are 163.6 deaths per 1,000 person or 1,000 people due to heart diseases. And this data was retrieved in 2018. Along with this, we also found that there is one heart attack every 40 seconds. That's a very high frequency in the United States that's unseen. Now, one of the thing when you have a heart attack is that you will call the ambulance and the ambulance will bring you to the emergency room. Once you got into the emergency room with a iconic symptomatic chest pain of a heart attack, the ordering provider or the ordering physician usually ordered a troponin test. Now, what is troponin? Troponin is a important calcium ion binding protein, and this is a great cardiac biomarker to determine the level of potential acute coronary syndrome that the individual that either have the onset chest pain or have going to the emergency room for related reason might have. A troponin is comprised of three units: troponin C, T, and I. Troponin C is act as a calcium binding site. As you can see right here, troponin C is the red piece, T is the yellow piece, and I is the blue piece. C is the troponin binding site. Troponin I have an interaction with the myosin head, with the surrounding environment, exhibit inadequate amount of calcium ion. And along with this is that troponin T is attached to the complex, which result in the whole complex of tropomyosin and troponin bind to the actin and tropomyosin complex. Now, the thing that's most important is in the critical healthcare setting is cardiac troponin, otherwise known as CTN. This is the very specific type of isoforms that is very highly sensitive specifically to cardiac myocyte, thus was named cardiac troponin. Now, cardiac troponin is very useful and it is one of the benchmark to diagnose any type of chest pain or for potential treatment for heart diseases or onset heart acute onset coronary heart syndrome. Now, many healthcare facilities they adopted the fifth generation of the assay over traditional point of care tests of CTN. As the result, we now currently adopt a higher sensitivity cardiac troponin test that result in higher sensitivity and precision, which mean that you don't need that much sample size, but still remain with precision and accurate diagnose. It's allowed faster return times, and it also allows healthcare provider to perform assessments sufficiently to initiate treatment. Now, clinical significance of this is that it's shown one of the core concept of troponin is that 90% of patients admitted to the coronary care unit exhibit elevated concentration of troponin, and it's remained like that until the fourth day after admission. Now we can understand this by just take a look over the troponin levels of certain individual and figured out, hey, you have an elevated troponin level. You must have these these symptoms in the past, either chest pain or acute coronary syndrome. Now, every time you go into the hospital with onset chest pain or similarly in heart diseases, the ordering provider will order an electrocardiogram and CKMB, which is creatinine kinase. Is all of that work in conjunction with high sensitivity cardiac troponin, which led to the ultimate clinical assessment. Combine all of that together, and it will provide a great treatment plan for the patient. Now, in here you can see the suspected acute coronary syndrome going in. The order provider will first ordering a EKG, and as you can tell right here, troponin play a big part in determining what's the next move in the algorithm section. So most of the time, if troponin is repeated and it still remain high or it still remain unchanged, most of the time they would start treatment for myocardial infarction, which is basically a heart attack in scientific words. But however, if troponin is way under the 99 centiles, it will rule out the myocardial infarction as excluded. Now, potential complication of levels is that troponin does not always elevated or is not always elevated in individual that coming in with an acute coronary syndrome. It can also be caused by other chronic syndrome or other chronic diseases. Other chronic diseases such as chronic kidney disease. Now, up to 13% of patients exhibit elevation in troponin level in conjunction with chest pain, does not have any coronary symptoms. Now, the chronic diseases that might potentially contributed to this elevation in troponin level can be anemia, hypertension, pulmonary embolism, COPD is another one, neurological disorder, seizure, and other heart-related disease. So, in conclusion, cardiac biomarker is one of the most useful tools in clinical practices. The introduction of troponin assay, the high sensitivity cardiac troponin assay, has resulted in a fast and reliable algorithm. And when working with conjunction with other point of care tests, such as an electrocardiogram, it helped expedite the treatment process. Nonetheless, the etiology differentiation between certain patients need to be further examined before does not only use troponin as the only determining factor in any treatment plans, but have to take into account the pre-existing past medical history of the patient in conjunction with all of this. And yeah, this is my reference for all the sources and claims, and that's it. Thank you guys for attending my presentation.